Hi, Dr. Ace Thayer here, Balance Focus Neck Adjustments. Today we're presenting Joseph. He's a 27-year-old with 9 years of pain. He has hip and shoulder pain that's unrelenting. Again, 9 years of pain, can't sleep, smokes pot to try to get sleep, but it just doesn't seem to work for him. So he came here to get better. My favorite part about this is that he says a favorite line that I love. He goes, "If you ain't got haters, you ain't popping." I used to say that all the time, I forgot about that. So anyways, I love this guy. If you like it, like and subscribe, please. And we'll send these right to you. Love you. Take care. See you guys next time. Hi, Dr. Thayer here. I'm with Joseph. Joseph is a 27-year-old guy that has been suffering with pain for a number of years. Started in high school, but I told him I probably started earlier than that because he's been self-adjusting since he was a little kid. And he didn't realize he was in pain, but he just started self-adjusting and continued on, right? And so in 2009, pain started and never really went away. That was 9 years ago. Again, that's back in high school, okay? And he can trace it back to sports and stuff, but I think his stuff was even before that. So again, young guy, lots of pain. He's here primarily for his hip. He has some neck pain, some shoulder pain, all these other things, but his hip is really screwing him up. I think that's what really brought him in here. Interesting for him, he has a couple interesting accidents. He hit his head really hard on a cabinet when he was 7 years old. Twice, right? You did it one time, and you did it something else on the...
Yeah, I cracked my head open the back, and then I split it open the front, and there was like a couple years
difference between them.
Yeah.
And stitches and stuff. I mean, pretty
staples in the back, stitches in the front.
Yeah, well, so got him coming and going. So he bing bang boom, hit his head back and forth, and so that in a chiropractic sense, not a good thing.
Right.
So he started off young with this stuff, so that could have been the beginning of it, may not be, but he has a lot of issues now, and so I'm stoked to have him on camera because he's a little shy to get on camera, but we're happily is paying it forward to you guys who are young and have the same kind of pain he has, so other people can find in my office. Okay, so Joseph, why are you here?
My hip hurts as fuck, and my
That's
neck
fun.
and,
Yes,
my,
good.
and my back
I like
and
how
just pain.
he talks like me now, and that's how I diagnose my patients. You're fucked up. Yeah, so
I'm
good.
just cranky all the time because I don't sleep ever, so.
Yeah. When was the last time you actually slept?
Oh god, I don't know. When I was like 20 or 19.
Yeah. So he's a terrible sleeper. You can even see the way he's standing here. You can see how he's looking at me. He has anxiety.
Yeah.
It just oozes out of him.
Yeah.
And the reason anxiety, I'm not trying to embarrass him, but anxiety comes from lack of sleep. And so it's just lack of sleep. So no matter what he takes medication, probably smoke pot, probably do all this shit that you're gonna do to try to get and be like, if he just smokes the right stuff. Well, we even talked about this, but I already know he's done all this shit.
I tried the right stuff. It doesn't work.
It doesn't work, right? And so you guys will all say no, and you got like, he hasn't talked to me. I got the hookup. I know this fucking shit. And so you guys are all going to give me a hard time with this one, but we're going to make him sleep, and that's going to be the biggest thing for his recovery.
About it.
And so, anyways, tell us why you're here, sir.
Yeah, just like pain. Just constant pain, not sleeping through the night, anxious, depressed, just over it. And been watching videos for a bit.
The hips. And then tell us about shoulder pain, a little shoulder pain.
Oh, yeah, shoulder pain. I can't even do a pull-up. I can't work out, like, hurts. It's just discouraging. Yeah.
Tremors.
My hand, I was shaking, like, probably since I was like, I don't know, it started like 22, probably.
Yeah. So he's been shaking a long time.
Yeah.
Again, his body is falling apart. He has psoriasis too. His skin's starting to change. And why is that important? Well, it's not important that it's not a diagnosis that's causing a problem. It's an opportunistic thing of his body just absolutely breaking down. And it's breaking down at a young age. That's the crazy part about it. So he's been suffering so long. And I hate to say it, but it's from a lack of sleep.
Yeah.
Which is pain derived.
It's a vicious cycle.
It's a vicious cycle.
Yeah.
So again, we're going to change his life around, and he's again nervous, which I told him also is interesting because the young guys are nervous, and even the funny part is that they have the best chance of recovery because they're so young, but they come in the most nervous, and so it's interesting. So he's in good hands. We're going to take care of him. Good. Anything else you want to answer?
No, I'm good.
Good. Over here. Go ahead and better touch those as best you can. Okay. What kind of pain in your back?
That's like 5.
5. He's pointed at L5.
Yeah.
Back like this. How about that?
Similar, a little more actually, yeah.
A little more, about 6?
Yeah.
Gotcha. And so I look down the floor with your neck. How about that?
Like about 4 or 5, yeah.
So less in your back, right?
Yeah.
Same, please. How about that?
Same. Same, yeah.
Now go ahead and squat to the ground. This is the one you guys go.
I can get right there, and then I can stop.
And what's the pain there?
Like a 9, yeah, like 8 or 9. It's not fun. When I'm squatting, yeah, or going upstairs.
Let's just do it one more time. Show people.
Okay. I can go like a little lower, but it hurts like right there.
Right there, bad, right?
Yeah.
How long has that been hurting?
It's been getting worse like in the last few months because I was doing squats like not that long ago, so I don't really know. I don't know.
So, you guys will all be out there, because I hear this crap all day long, because you guys won't finish watching the movies, that, oh, well, he can't get better unless he adjusts his hip. Have you guys checked his feet yet?
Why do they sound like that?
Because they all sound like this in my head. Because it's
just a troll voice or what?
More and more pathetic in my head, this stuff. Because nobody ever watches the video. They just want to jump to the conclusions that I'm not helping you.
Yeah.
So, anyways, watch the freaking video and then make a decision.
It's only 11 minutes.
You can bag on me if you want, but just watch the video. Okay, so, anyways, I've been dealing with a lot of haters on that lately.
True.
They kind of echo
You
in
ain't
my
got no
head.
haters, you ain't popping. So
I ain't exactly. Norm. Okay, so, go ahead and lay you back over there, sir. You ain't popping. I haven't said that in a long time.
Yeah.
You took the words out of my mouth. I used to say that all the time. Okay, so hands on your belly button right there. Good, perfect. So just relax best you can, okay? Interesting thing about him is his grade 1 spondylolisthesis, which means his low back is a congenital anomaly. His L5 slipped forward a little bit. You need to know that in the future. I'll show you that when we go over your x-rays.
Cool.
I talked really fast on that one, sorry. Definitely imbalances. Massive kyphosis in his neck. His neck goes completely opposite way, so plenty of reasons why he's not sleeping.
Damn.
Easy peasy to see this thing. And so I'll put all the arrows there, check it out. But the spondylo and the kyphosis in his neck are the two big things. And treatment for this so far, you've done one chiropractor twice, right?
Correct.
And then no physical therapy really, no drugs, no prescription drugs. Okay, none of that kind of stuff. No physical therapy. Gotcha. Okay. Did the chiropractor adjust your neck at least? They didn't even adjust your neck. Adjusted your hip probably, right?
No, my back.
Your back.
Yeah. I didn't really feel anything or hear anything. I just kind of felt like a little better, but I don't really know.
Yeah. We'll see if you feel this. Okay, just relax. Best you can, okay?
Holy fuck.
Okay. Is that similar to the other experience you had with the other chiropractor?
No, not so much.
Did you feel something?
Yeah, I was kind of hurt a little bit, but
Gotcha.
But you know, it is.
That's fine. It hurts a little bit. What else are you feeling?
I think good.
You don't even know right now.
Yeah, I'm not really sure. Yeah, I'm
traumatizing.
chilling. I'm just chilling.
That's fine. I'm trying to get as honest as I can on there.
Yeah.
Yeah. Is that what you expected?
Yeah. I mean, I've seen like these things, so I get it. But you know,
When it actually happens.
yeah, when it actually happens, it's a lot louder than you're ready for, I guess. Oh.
Yeah. Your neck went a country mile. That's for sure.
Fuck. Yeah. Holy shit. Yeah.
Good. You made it, dude.
Yeah.
Can you wiggle your fingers and toes still?
Yeah.
There you go. Good.
We're not crippled, so we're good.
Okay, so remember when you get up, no twist and turning, right?
Right.
Look straight ahead. Keep your arms to your side. Okay. Come on, sit up, please.
A little lightheaded.
Good. Look straight ahead over here. Sorry. Anything else?
Yeah. Relief in my shoulder for sure. Yeah. On the
No,
way.
I'm waiting for this one more thing because I can already see it.
What?
I'm not going to tell you. I want to
Okay,
see
don't
if you
tell
come
me.
with it. Yes, but I want to say anything else. One more thing that I can see. That I can already see it in your face that you're better with. I just want to see if you come up with it because
I
they'll
don't
tell me.
know. Wait.
It's okay. We'll just do it. We'll do it later.
Tell me later. Yeah,
Yeah,
that's cool.
that's fine because they all think I'm leading. But,
Yeah.
leading you. So shoulder feels better right away.
Yeah.
How's it breathing?
I feel it. Yeah, but yeah, if I can, feels like looser, like yeah, not as much pain when I take a full breath.
Perfect. Put
So,
your arm down.
sorry.
Let's keep it relaxed.
Word.
Look straight ahead. Arms down. Watch the door, please. Why are you smiling?
You know why I'm
I
smiling.
know why you're smiling. Okay, breathe in your nose. One more time.
Oh god.
Oh, big game tonight, guys. Rams, Kansas City.
What?
Monday Night Football.
Oh, true.
Yeah. Well, tell us what else you're feeling right now.
My neck feels like pretty nice. I want to play with it, but I'm not.
Good. It's nice you're refraining.
But I can
that.
feel that it doesn't hurt, like even just like minor emotions. Like I don't feel the pain.
What else? We'll go through everything we did in there. I'm just kind of curious, just off the top of your head.
Yeah, I'm excited to squat. Tingles and like a little tingle in my hand.
Gotcha.
I think that's it.
Gotcha. How was your walk? Did you feel like you were
Yeah,
walking different?
Yeah, I felt less like when I was walking in here from the parking lot, I feel myself like kind of to the side. Like I always feel myself like kind of cocked in like a weird position. I feel much like straighter, and it doesn't hurt to stand completely straight. Right? Usually I'm like forcing myself because I know I'm supposed to, but it hurts like a bitch, so I like don't do it.
Cool. So it's those kind of things are different.
Right.
Let's check how you feel. Bend over, touch toes, please. That was a 5, I think.
Yeah, I'd say like 3.
Okay, so a little bit less.
Yeah,
Right? Go ahead and go back.
Oh yeah, that one is similar, 2 or 3. It's still like stiff, but it doesn't like the pain is not as bad.
Gotcha. And so you guys are like, it didn't all go away.
Yeah.
The problem is that there's still some semblance of an injury in the joint.
Yeah.
Leverage causes torque. That torque puts pressure on the joint. We've decreased the lever instantaneously. He feels that lever difference. But again, there's still some injury in there, so that'll take a little bit of time to squeeze you out of there. I think I always kind of wonder why that happens. Look at the floor, please. Let's see.
Yeah, definitely less pain. Still stiff though. Just like less pain.
Fair enough. Let's squat now.
Alright. I can get low. It hurts, but I can get lower. I can like push through it. Like before, I'd stop like what, right here ish.
9.
Yeah, and it was bad. So like this is still probably like a 5 or a 6. Still hurts, but I can do it. It's not excruciating.
You guys see the power
to
too?
the point. Yeah, that was
How much-
fire.
That was you actually had strength too.
Yeah, strength. I could come back up. Yeah.
And so, what do you think of the process so far?
It's dope.
It's dope.
Yeah.
This guy's like he's like in a time warp. He's like word, dope. I mean, I love this.
Who knows?
I know, but I love it. You say it with such conviction. I know you believe it. So,
true.
anyways, I appreciate you letting me do the video. We'll do a follow up for you for sure because you're gonna be here again. And you're gonna get much better.
Yeah.
And so, thank you very much. I can see it, guys. I hope you guys can see it. He's doing better already. And the thing I was gonna say that he hasn't said yet is he can focus a lot more.
Interesting.
You look like you can concentrate more.
Okay.
Yeah, because if you look at his eyes, when he on the beginning of the video, he was like this, like looking around.
Oh yeah, true.
And as soon as I adjusted you, his gaze is like sharp. Yeah, he may not notice that, but again, it's plain as day. You can see it in his eyes.
I feel better too. Like it's good.
Good.
It's good.
Thanks for watching, guys. See you next time.